Hey all, this is Dr. Tonya Olson with Dr. Tonya Footcare and Fixing Your Feet. And in this video, I want to talk about safe, sharp instrument handling for when you're lancing a blister. So ideally, when you're working with a runner, especially during an event, you want to not harm them. And when you're holding a sharp instrument and lancing a blister, that's the most likely avenue of causing harm to a runner. So here's some just technique tips and tricks for you. So first of all, communication is critical. So before I unsheath the needle, I'll make eye contact with the runner and say, I'm going to lance the blister or got a sharp instrument. And then I'll look at whoever is around us and I will just say, sharp instrument, careful, something like that. Make sure you're making eye contact and that everyone sees. And then you take the needle out, unsheath the needle, and always be mindful of the angle of the needle. You always want it to be pointing up so that if anything happens, it goes away from the runner's foot. And so I'm going to demonstrate. Let's pretend this is a finger or this is a toe, and I'm going to lance a blood blister underneath it. And so first of all, you keep the needle angled upwards, stabilize the heel of your hand on the foot, and then take your other fingers of your hand and stabilize them nearer to the body, the place on the foot where you're going to be lancing. And the other critical orientation of the needle is you always want to be parallel to the skin, parallel to the anatomy that you are piercing, so that if anything happens, you don't stab down into the foot, into the skin, and cause an injury. So you're stabilizing the heel of your hand, you're stabilizing the fingers, and then if you're lancing an under the nail blister, you go straight parallel to the toenail, go right underneath the toenail itself, and if you stabilize the needle against the underside of the toenail, that will keep you safe from diving into the nail bed. It will be a lot less painful for the runner because at that tissue toenail interface, right where the nail is the thinnest. And so it'll be really easy for you to lance. And also be mindful if it is an under the nail blood blister, you need to have like a piece of gauze to absorb the fluid that's going to ooze out pretty quickly. So just be thinking, stabilize, and stay parallel or upwards. And you are greatly reducing your risk for causing harm, right? Do no harm. So hope these tips and tricks are helpful for you.